Hi there and welcome to this video. My name's Kris, I'm an Australian GP, and real talk, I sometimes wish it was ethical to prescribe my patients placebo pills. It's a strong stance, I know. However, I don't feel like it's that far-fetched because there have been beautiful studies done that prove the efficacy of placebo. Sometimes it is a mind over matter thing. Before we go any further, I want to make it very clear that this is not me saying that I want to or currently lie to my patients. That couldn't be further from the truth. However, sometimes the simple act of being prescribed something or being told to take something can really work a lot. The complexities of conditions such as sleep and weight loss immediately spring to mind. Sometimes it really feels like I, as the GP, am fighting a losing battle, or at least fighting uphill when I'm talking about the intricacies of sleep hygiene and the relay between getting enough sunlight during the day, which then helps your melatonin at night, but also with weight loss, talking about, it's not just calories in, calories out, it's about movement, but you shouldn't just be going off the scale. You also need to be looking at how your energy is improving and the way your clothes fit. And it's just sometimes I wish I could give all of that and say, and take this pill and it'll make it easier for you. I especially wish this was a possibility for me with patients who do come in and they just want a pill and a quick fix. Because again, going back to the examples of insomnia and weight loss, or at least, being overweight, there is no quick fix. There is no pill, take this and it'll get better. Sure, there are medications that can help, so sleeping tablets, but they've got a whole list of side effects, can be awfully addictive, and sometimes the sleep you're getting is actually a sedation, which is not so good. And when it comes to weight loss, same thing. There are medications out there, including injections, with wonderful results. However, without lifestyle intervention, it's not easy. And you'll take it, then you'll lose the weight, and you stop it, then you put it back on, and it's yo-yo. And that's something we as medical professionals and as people in general don't want to perpetuate. Yo-yoing, it sucks. Plus, a lot of the weight loss medications we do have awful side effects too. Placebo pills don't. So what exactly is a placebo? A placebo is an intervention given which is known not to contain any active ingredients, but it's given under the guise that it may contain something active or that it will do something for you. In more scientific terms, and I'm going to read this because trying to get it all out at once is hard, placebo refers to the psychobiological process which gives rise to genuine therapeutic effects for a range of conditions. These often cause an alleviation in self-reported symptoms within a range of conditions, including but not limited to depression, anxiety, IBS, migraines, and pain. Placebos are used every single day in clinical trials worldwide, and they are used to determine the efficacy or how effective a medication is. So, something to compare to. The placebos are the controls in the study. So why does the placebo effect exist, and why does it work? Well, the jury is still kind of out on that one. But what we do know is there is a combination of conscious and unconscious responses to not only an expectation, but conditioning and social learning. There is a whole subfield of medicine dedicated to the study of the neurobiology behind the placebo effect. So again, this is like just a 101, but it is actual science. So why don't we prescribe placebo pills? The problem with placebo prescribing, at least at the forefront of my brain, is the lack of informed consent. The difference between the placebos in the trials and the placebos that I wish I could prescribe, semi-jokingly, is that in the trials, patients knew that there was a 50% chance that they would be given a placebo pill versus an active pill or something that had medication in it. They knew that that was a risk, or at least a possibility. This is common in blind studies, but sometimes in medicine we do studies that aren't blind, wherein someone knows that they're taking a placebo pill and knows they're taking a medicated pill. In medicine, we practice a beautiful balance of beneficence and non-maleficence. That is, doing right by our patients and do no harm. There is also a lot of weight placed on patient autonomy. That is, the right to choose what happens to their own body. Of course, the right to choose also encapsulates the right to be consented properly after being dutifully informed. Prescribing Tic Tacs for sleep isn't quite an informed consent, is it? So what do we know then? Let's just kind of summarize here. We know that the placebo effect exists. We know that the placebo effect is powerful. We know that a positive attitude can be really helpful for outcomes, especially in conditions that I mentioned before, like depression, anxiety, IBS, stress, pain, etc. We also know that the body can and does respond to placebo pills. There is a biochemical and a physical reaction that we can absolutely study and have studied. It's very similar to the way that, if you've heard of the story of Pavlov's dogs, he would ring a bell, give him a treat, and by the end of the experiment, he would ring the bell and the dogs would be salivating even without being given the treat. It is that anticipation of it. So giving a placebo pill, if someone expects it's going to have an outcome, taking the pill, suddenly they will feel better in some way. The final thing we do know is that if a placebo is prescribed, taking the pills faithfully and regularly is super important. It's just as important as taking a non-placebo medication. Perhaps one day we will see placebos being prescribed. Again, I'm sort of cautious of the ethical boundaries that may be crossed in these, but at the moment there is a lot of studies going into open label placebo trials where patients know they're taking a placebo, but it's still getting really good effect. So watch this space and trust that until stated otherwise, anything that I personally prescribe you is not placebo. As always, if in doubt about your own personal medical issues, please talk to your own GP. I'm just someone on the internet with some medical knowledge, sharing my thoughts, sharing information, and sharing sometimes the ethical grey zones that are present in medicine at times. If you liked this and you enjoyed my rambling, please leave a like. If you have any comments about it or have any suggestions for future videos, please leave a comment below. Please consider subscribing if you haven't already. And until next time, guys, stay safe, stay healthy, and I'll see you in a video very soon. Bye.